Cognitive behavior therapy is the main alternative contender to antidepressant drugs. And it's based on the premise that depression is secondary to negative thoughts, that you think yourself into a low mood. Low mood is seen as the consequence of having self-destructive or maladaptive thought patterns. For example, a person has lost their job and they would say, well, economic conditions are difficult, they had to let somebody go, and they would set out looking for another job. Whereas the person with a negative thought pattern would conclude from that, I've lost my job, I'm totally useless, nobody will ever give me another job again. And the cognitive behavior therapist will say, that is the thought pattern that needs to be changed. So they challenge that mode of thinking and hope that by cutting in at that point, the depressive thoughts, they can alter the emotions, hence actions, and the vicious cycle can be broken. Now, it has to be said that most of the research that has been done on this suggests that mood and maladaptive thinking tend to go in parallel. That is, one does not take causal priority over the other, but it doesn't matter too much because you can intercede at any point in the cycle and hopefully do some good. Most patients who come into a surgery with a major depression are prescribed drugs initially, but only about 40% of them get better after a 2 or 3 month period. And then they try another approach, might be CBT. But it would be very useful to know in advance which patient is going to benefit from which kind of treatment. And there is this research using PET scans, positive emission tomography, to show that if a person shows high spontaneous activity in this area, their anterior insula, this is the front of the brain, so it's the anterior part of the insula, will do better with drugs than with CBT. If they have low activity in that area of the brain, they tend to do better with cognitive behavior therapy than they do with drugs. So that theoretically would be a way of deciding who should get what treatment, but of course it's extremely expensive and intrusive, and the search is on for more practical ways of deciding, of personalizing treatment, one of which might be gene markers, because it has been shown, for example, that people with the short cert, serotonin transporter, will benefit more from cognitive behavior therapy than from drugs. You can monitor recovery processes in the brain, and again using PET scans, comparing what's happening in the brain with drugs and with cognitive behavior therapy. And the interesting thing is that you arrive at the same point but from different directions. It appears the people who've done this research interpret their results, and it looks a bit of a mess. Take you a while to sort your way through that. That's CBT, that is an SSRI. But they describe the difference as being a bottom-up chain of events that is starting in the midbrain with the drugs and moving up to the cortex, midbrain cortex, as against top-down for cognitive behavior therapy, which is that the effect seems to start in the control centers of the frontal part of the brain and moves down to the midbrain. So you can get to the same place, but from different starting points. Now, there was a time when it was thought by neuroscientists that we were born with all the nerve cells in our head that we would ever have. And it was just a matter of these dropping out and decaying. But recent research using carbon-14 dating of nerve cells shows that, in fact, new cells are being generated in the hippocampus. Radioactive carbon-14 is interesting because There was plenty of it about in the atmosphere when they were all, the Americans and Russians and so on, were testing their bombs. But after the nuclear test ban in the 1960s, the carbon-14 levels in the atmosphere declined, and that has enabled us to tell at what point in a person's life particular cells in the hippocampus were generated. And here it is here, the stem cells turning into full mature neurons within the hippocampus. And it was possible, with post-mortem data obviously, to date the origin of cells, and it was discovered that we had something called neurogenesis, which is new neurons being generated within the lifetime of the individual. But depressed patients showed less new nerve growth in this area. And the other interesting finding was that antidepressant drugs tend to promote the growth of new cells originating in the hippocampus.